Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with infections, infestations, and the immune system, starting with the letter A. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, and then homeopathic remedies on infections, infestations, and the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, then homeopathic remedies for infants, ailments, diseases in childhood, special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus. Or arsenic amalgam types, those who react strongly to arsenic amalgam. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings, and an account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with infections, infestation, and the immune system, starting with the letter A. Infections are an almost daily occurrence, but if we are healthy, our immune system deals with them before we notice any symptoms. Most microorganisms enter the body through the nose and mouth, in the air, in our food, sometimes on dirty fingers. Some enter through cuts and abrasions, while others invade the urinary or reproductive tract through the urethra or vagina. Many of the microorganisms which we share this planet are harmless. Some permanently inhabit the inside and outside of the human body. A few even produce substances useful to it and prevent harmful bacteria from finding a foothold. This is true of certain bacteria in the large intestine and vagina. Some bacteria are harmless in one part of the body, but damaging in others. This is true of E. coli, which is benign while it is in the colon or rectum, but harmful if it is transferred to the urethra, vagina, or mouth. Each kind of microorganism, whether it is a bacterium, virus, fungus, or blood parasite, carries special chemical markers known as antigens. Some strains of lymphocyte, which is a kind of white blood cell produced in the lymph nodes, spleen, bone marrow, adenoids, tonsils, and the wall of the gut, recognize antigens and stimulate other lymphocytes to produce proteins called antibodies, which then disable the carrier organism. Other lymphocytes directly attack and destroy the invading organism. For about 6 months after birth, babies are protected by the mother's antibodies. After that, the immune system is sufficiently mature to start manufacturing its own. Homeopathic immunization does not involve introducing live or dead viruses or antibodies into the body. Instead, remedies are prepared from diseased tissue or secretions using the traditional dilution and succession method. Like other homeopathic remedies, they contain in highly potent form the essence of the source material used, in this case, the essence of the disease organism and its toxins. The body reacts to such remedies known as nosodes by sharpening its immune response. The production of antibodies in response to antigens, the so-called immune response, is not the body's only line of defense. The body's first line troubleshooters are neutrophils and macrophages, which are two kinds of white blood cells that constantly patrol the bloodstream and tissue fluids and respond immediately to the chemical and thermal signals sent out by tissues when they become inflamed. If inflammation is suppressed, white cell activity is impaired. Neutrophils and macrophages gobble up and digest offending microbes, foreign particles, and other noxious elements. The resulting pus is a mixture of necrotic tissue, dead bacteria, and dying white blood cells. Infections can be treated by killing the germs that cause them or by helping the immune system to deal with them, or both, depending on general health and the virulence of the infection. Traditional antibiotics can deal with bacteria, but not viruses. After a course of antibiotics, live yogurt or kefir, eaten daily for at least 5 days, helps to repopulate the gut with the beneficial bacteria that the antibiotics have killed, along with the harmful bacteria that was their main target. Homeopathic remedies improve nutrition, fresh air, exercise, and rest, can restore the coping ability of the immune system. In some cases, homeopathic remedies and antibiotics used together may be necessary. Constitutional homeopathic treatment is always advisable after serious infections. Occasionally, as a result of aging or exposure to certain viruses, bacteria, chemicals, and environmental factors, the body loses some of its ability to discriminate between self and non-self, or fails to recognize and destroy its own abnormal cells. Excuse me. The first kind of impairment leads to autoimmune disease, such as rheumatoid arthritis and systemic lupus. The second leads to cancer. Allergies, distressing reactions to certain drugs, chemicals, food, and other substances that seem to be tolerated by the majority of people are the downside of having an immune system. Allergy. An allergy is conventionally thought of as an excessive reaction between an allergen and an antibody. Some people, through their genetic inheritance, produce large numbers of the kind of antibodies that cause the release of large quantities of histamine when they bind to certain allergens. Histamine causes large quantities of fluid to leak out of blood vessels and tissues, resulting in the distressing symptoms of allergies, which include local swelling, redness, and itching. Into this category of allergic reactions comes hay fever and allergic rhinitis, celiac disease, certain forms of asthma, and conjunctivitis, eczema, and urticaria. In a few people, the histamine reaction occurs throughout the body, anaphylaxia, and can cause death from shock or suffocation. The other extreme allergies are known to cause the headaches and feelings of fullness in the head, excessive drowsiness after eating, insomnia, ringing in the ears, recurrent sinusitis and ear infections, sore throat, nausea and vomiting, diarrhea, constipation, flatulence, abdominal pain, chronic fatigue, aching joints and muscles, binge eating, anxiety attacks, depression, tearfulness, unusually aggressive behavior, apathy, confusion, hyperactivity, and an inability to concentrate. In such cases, mechanisms other than the classic allergen antibody response are almost certainly involved. Among the many substances known to cause allergic reactions are dust, house dust mites, fur and feathers, tree and grass pollens, various plants, wool and other fabrics, nickel and other metals, gases and vapors given off by gas appliances, household cleaners, paints, solvents, and plastics, pesticide residue, non-stick coatings, various drugs including penicillin, and of course many foods and food additives. Desensitization treatment, which is carefully controlled exposure to progressively stronger doses of the allergen concerned, only works if one or two substances are involved and should only be tried if other measures fail, because it is not a surefire cure. In some people, desensitization works for a while, then the allergy returns more violently before and is more difficult to treat. Suppressing allergy symptoms with antihistamines, steroids, and decongestants is not recommended, unless the symptoms are making life unbearable. The specific homeopathic remedies given under the conditions mentioned above should be tried first. Broadly speaking, there are two kinds of allergy: fixed allergy and cyclic allergies. A fixed allergy is one that declares itself before the age of 2. One school of thought attributes this kind of allergy to a leaky bowel. The walls of the bowel are such that certain proteins easily pass into the bloodstream, where they are identified as foreign and trigger antibody production. The bowel may be leaky from birth, or leakiness may develop as a result of inflammation or candida infestation. The permanent presence in the blood of large numbers of antibodies that would not normally be there seems to encourage allergic reactions. Most fixed allergies involve single substances. Cyclic allergies tend to occur in older people and only declare themselves after repeated exposure to certain substances. Usually, several substances are involved. Exposure may not always cause a reaction because up to a point, the body develops tolerance. This is known as allergy masking. In some people, identifying and eliminating one substance or group of substances uncovers a sensitivity to others. It is as if removing one allergy obliges the body to find another way, and sometimes a more unpleasant way of expressing its imbalances. This is why initial treatment should be constitutional. If this fails, avoidance of specific substances is the logical next step, provided nutrition is not compromised by cutting out too many foods. Food allergies may be fixed or cyclic and can declare themselves in many ways, as rashes, stomach upsets, mood swings, hyperactivity, aggression, general tiredness, apathy, and malaise, and as cravings. If you suspect you have a food allergy, the first items to be suspicious of are foods that upset you, foods that you crave or find difficult to resist, foods you would miss if you were asked to give them up, foods that make you feel better after eating them. In this context, foods include beverages. Self-help. There are a number of simple tests you can do yourself if you suspect you have a food allergy. Test the foods mentioned above. Eliminate them one at a time. Never eliminate more than one food at a time. This is called elimination and challenge testing. Eliminate each food for at least 4 days, then reintroduce it within 12 days. If you feel better after not eating it, and worse when you reintroduce it, you are probably allergic to it. Once you have established which foods are safe, take care to eat them on a rotational basis. If you eat them too frequently, you may develop intolerance to them again. You should also try the pulse test. This involves taking your pulse before you eat a particular food and again afterwards to see if your pulse rate rises rapidly or not. If it does, you're probably allergic to that food. To take your pulse, place your fingers lightly on the thumb side of the inside of the wrist for 30 seconds and count the number of beats. This test only works if you are calm and breathing quietly to start with, and if your pulse rate is not too variable. If your pulse rate is more or less the same on 5 successive occasions, then you have been sitting calmly for 15 minutes or so. The test may work well for you. If you suspect that paints, plastics, or household chemicals may be the culprit, try the sniff test. Go for an hour's walk in the fresh air, and when you get home, quickly go around the house, sniffing anything that gives out a strong smell. The smell that affects you the most may well be the one with which you are allergic to. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.